Rwanda, the land of 1,000 hills, a nation rebuilt with resilience and vision. From the tragic history of the 1994 genocide against the Tutsi, the country rose with determination to transform. By the early 2000s, Rwanda was one of Africa's fastest growing economies, achieving remarkable progress in health, education, and governance. Yet, as a developing country, one urgent challenge persisted: access to safe water, sanitation, and hygiene. Millions of Rwandans still walked long distances for unsafe water. Families lived without decent toilets and hygiene. Preventable diseases claimed lives, and poor wash services weakened health systems and kept children out of school. In 2010, WaterAid came to Rwanda with a mission: to transform lives by ensuring that everyone, everywhere, has access to safe water, sanitation, and hygiene. This is our story, a journey of hope, challenges, and transformation. In just 15 years, WaterAid Rwanda has transformed lives across homes, schools, and health centers. More than 463,000 people now have clean water. Over 253,000 people have gained decent toilets. More than 2.7 million people have been reached with hygiene promotion. Access to clean water in Bugesera, our pioneer district, rose from 25% to nearly 76%. Our journey began in Bugesera district, where only a quarter of the population had access to wash infrastructure. Between 2010 and 2015, we laid the foundation for what would become a lasting transformation. These early years were a time of discovery, testing technologies, building partnerships, and listening to communities. We started small: a borehole here, a rainwater tank there, a hygiene club under a tree. But every small step sparked big change. For children, it meant fewer days lost to sickness. For mothers, it meant precious hours regained. For communities, it meant renewed hope. In 2016, WaterAid Rwanda became a fully fledged country program and launched its first 5-year strategy. No longer just delivering projects, but strengthening systems that last. Together with the government of Rwanda, civil society, and partners, we pioneered the district-wide approach, empowering districts to plan, finance, and deliver sustainable wash. First piloted in Bugesera district, this model was later adopted in 27 rural districts, becoming the backbone of Rwanda's path to universal access. By 2022, our first strategy had reached more than 4,300 villages, bringing clean water to 283,000 people, sanitation to 223,000 people, and hygiene promotion to nearly 2 million. More than 537 schools and 57 health centers gained safe wash facilities, showing that water and sanitation are not just infrastructure, but a foundation for health, dignity, and opportunity. When COVID-19 struck, we responded swiftly with nationwide hygiene campaigns and hand-washing facilities in schools, health centers, and public spaces, protecting lives at a critical moment. The sixth goal among the United Nations Sustainable Development Goals, SDGs, is to ensure availability and sustainable management of water and sanitation for all. Rwanda's National Strategy for Transformation NST2 2024-2029 now prioritizes WASH as a cornerstone of development, aiming for universal access by expanding household coverage, constructing modern treatment plants and sewage systems, and accelerating universal WASH in every village. But this vision has not yet been achieved, especially in Bugesera, where we have focused much of our work. Our focus is still in Bugesera because our recent service level assessment revealed that while access to clean water in Bugesera has risen to 76% in terms of infrastructure, the reliable access to water service at household level remains just 23%, school level 66%, and 51% for healthcare facilities. The main barriers include limited financial resources, the effects of climate change, limited production capacity, high levels of non-revenue water, and inadequate distribution systems. Bridging the gaps required at least $60 million in financing to meet demand in Bugesera district alone. Our 2023-2028 country program strategy focuses on modeling climate-resilient, gender-responsive, and inclusive WASH. We have two bold aims. One, to achieve universal, sustainable, safe, and inclusive services in Bugesera district as a model to influence national change. Two, to prioritize WASH across the health sector, because clean water and hygiene are essential for stronger healthcare, disease prevention, and saving lives. We believe this is possible, and we can make it happen together. Join us on the journey to universal access in Bugesera, because change starts with water. We are calling on government, the private sector, civil society, and all those with the power to deliver change to play their part, because access to clean water, decent toilets, and good hygiene is not a luxury. It is a human right. To achieve universality in Bugesera, we must increase water production, reduce non-revenue water, and improve urban sanitation as the district rapidly grows. With stronger partnerships and bolder investments, universal access is possible, but only if we act now, together. Let us act with urgency and unity to ensure that every Rwandan enjoys this right.